Programan Salapi Azudon Itato, a direct disaster aid program. Yes, sir. That will be paid for with the coronavirus relief funds authorized under the CARES Act. Under this program, individuals applying, depending on their household size, making equal to or below 165% of the federal poverty level, are 18 years or older and have been residents of Guam for at least 6 months, will be paid $300 per eligible person, not to exceed $1,200 per household. As an example, for a household of one, 165% of the federal poverty level is 1,718 a month. This adjusts with every additional individual, adult or child in the household. This means for a household of four and above, they will receive up to 1,200. Using existing data from public health, this would immediately cover more than 18,000 households, representing 55,000 people. I am ordering that the first checks be cut on Friday, May 8th. For those that may be eligible and have not received a payment, they may apply with the Department of Public Health. The application can be found on Public Health's website, and applications can be dropped off at Public Health Castle Mall, Suite 16 in Manila. Applications can be mailed to Public Assistance at dphss.guam.gov. People can apply until next week, Friday, May 15. Additionally, Executive Order 2020-13 that would take four immediate steps in increasing our administrative transparency with the use of federal funds relative to COVID-19. First, as a businesswoman and governor, I have always valued independent, third-party review of programs and their related expenses. For this reason, as always, we will fully comply with any audit requirements given to us by the Office of Public Accountability, and I have ordered the procurement of an independent third-party reviewer for federal funds used during this response effort. This means that in addition to local audits conducted by the OPA and audits conducted by the federal government, we will also submit ourselves to concurrent review by an independent third party. I also want to note that I have transmitted a budget for the use of COVID-19 funds under the CARES Act to the Speaker of the Legislature and the Chairman on Appropriations. Adding to our increased transparency efforts, effectively, immediately, responses provided by any executive branch line agency to request for documents related to this emergency will be submitted to the Attorney General's office to post on its website. This submission will be made no more than 2 days from the date of the response to the Sunshine Act request. All line agencies will compile responses provided relative to this disaster since the declaration of the public health emergency on March 14th and submit them to the Attorney General's office. This will allow every citizen the opportunity to regularly review documents secured under FOIA and our responses to them. Through Executive Order 2020-13, I will also establish the COVID-19 Pandemic Recovery Office to act as a single repository of information related to COVID-19 response and recovery. I ask for you to close businesses, cancel social gathering of any kind, and stay at home, all in an effort to keep our friends, our families, and our community alive. Despite the uncertainty, our island acted collectively, not because of any order, but because we cared deeply for each other. I will be forever grateful for your courage and patience during these unprecedented times. All right, thank you, Governor.
Now we're going to open up the floor to questions. Just to remind everybody, the governor will take any and all questions. Each representative will be given an opportunity to ask one question and one follow-up for multiple rounds. And as a courtesy to each reporter, we ask that you regulate your individual mics and give others that courtesy during their turn. We'll begin with I-94, Adriana Quintero.
Hi everyone, how's everyone doing?
Hi, everything.
Good, thank you, Adriana.
Okay, so for my first question, we recently had Lieutenant Governor Josh Tenorio, and he had on our Containing COVID morning segment, and he told KUAM News that the emergency procurement of hotels for the government of Guam, quarantine and isolation facilities does raise some red flags. He also said that based on his experience, the way the legal counsel has handled this emergency procurement and is in a way that emergency procurement is not supposed to be handled. The Lieutenant Governor also raised issues with the fact that the Public Health Director, Linda DeNorcy's digital signature was being used on quarantine procurement documents without her approval or knowledge. And in addition, Legislative Procurement Oversight Chair Senator Sabina Perez told KUAM News that DeNorcy's signature being used without her approval was, quote, fraud. With all this being said, do you still stand by your legal counsel's handling of this procurement, and do you believe it will stand up to federal scrutiny for reimbursement?
So I just want to also start off by saying this COVID crisis has been a very unprecedented event. This kind of emergency has never been experienced by anyone here, and also by anyone globally or even nationally. We have heard many messages from all over saying that this emergency is really a very serious kind of virus disease.
Yeah. So
and in saying that, when we got our 3 contact COVID positives, we quickly and expeditiously and aggressively put in measures to try and contain this virus. Why? Because we want to save the lives of our people, and we want to contain this virus. So in the issues of procurement, when I declared a public health emergency under the Public Health Act that was passed by the legislature, when I declared that, that gave me some powers to quickly act and to quickly make decisions and to quickly get the resources that I need in order to save the lives of our people. One of that is suspending rules and regulations, which also related and applied to procurement.
They still have
so
to
when
follow
we
the
got
law.
These contact people, and we were public health wanted to do a quarantine of all people coming in, we went forward and got the facilities. The way that we handled this procurement and the way that we used our emergency powers are within the law as stated. I truly, fully believe that the legal counsel and the legal team acted appropriately. They acted within the bounds of the law, and they acted quickly to help in helping the community contain this virus. So yes, I stand behind my legal counsel's actions.
Okay, and for a follow-up then, so the pandemic response plan assigns GHS and the Office of Civil Defense to handle procurement. So why did you feel it was necessary for your legal counsel to handle negotiations for quarantine isolation facilities? And what else is being negotiated on behalf of the government in response to COVID-19?
So I directed my legal counsel to quickly handle this situation. And yes, once contracts are signed, once agreements are made, they go through FEMA. And when we decided to go out forward, we decided that we wanted to work quickly, like I said, and we work with GHRA. So FEMA is put in the loop. We give all the information to FEMA, and there were discussions with FEMA about this facility. There were discussions with the Homeland Security, so FEMA was aware of what we were doing.
I can continue with more questions?
No.
Or are we gonna go in rounds?
We're gonna go in rounds. Thank you, Adriana. Next is Nick Delgado
Get her, Nick.
from The Point.
Get her, Nick. Stay on her,
One
guys.
second, let me just. Go ahead, Nick.
Half day, Governor. Half day, everyone. Before I get to my questions, I just want to say, as a professional who helped share the news here at home, thank you to your administration for the apology to what happened at last Thursday's press conference. To the Lieutenant Governor, though you were in the same room where the media was being censored, you apologized 4 days later, and we heard you. To the Governor's Policy Director, Carlo Branch, you called the editors and reporters who were not specifically being censored that day, but the message was received. Now to the questions for the Governor. We hear some tests, and specifically the Abbott test kits, have been compromised by a faulty process, including dilution issues. Can you confirm what test kits or machines and how many potential false negatives we recorded?
Yes, so that I think was a report nationwide through, I think, CDC. And what was happening there, Nick, was the volume of the dilution when you put the specimen in the solution was the cause of those false negatives. And they had already sent out and corrected this. And so our test laboratories here, where we were testing them appropriately and within the corrected procedures. So we were not using 3 millimeters, we were using 1 millimeter. And as a result of that, our tests are accurate.
Okay. Can you tell us more about Linda's digital signature being used without her consent on documents pertaining to those government quarantine facilities? Who will be held responsible, if anyone? And who are all of the cabinet and government workers staying at that site, for how long and why, and what costs to taxpayers?
Okay, so I think there's like 3 questions there, Nick, and I just want to make sure I answered them. So if I forget the other 2, just remind me, okay?
Yes, Governor.
All right. So the first question was the digital signature, right?
Yes, ma'am.
The electronic signature. Was that your first question, Nick?
Yes, Governor, about
right.
Linda's.
So we do have a policy about electronic signatures, and that is electronic signatures are not to be used unless it is authorized by the person who holds the signature. And that is our protocol. And I do know that that does work because I have been involved in authorizing electronic signatures. As far as Linda is concerned, there was no contract that was ever brought to her attention. There was what was brought to her attention was a letter, and it was not a document presented before her. It was read over the telephone, and her permission was asked. And she gave and authorized her permission to that particular letter. Now, she did say to me that she does not remember and she does not recall, and that can be also plausible because as Linda is the director of public health and there's many things coming her way, many decisions she has to make, I can agree that she does not recall or does not remember it. What was the second question, Nick?
About who all of the cabinet and government workers were were placed or able to stay over at the quarantine facility, and for how long and why, and at what cost?
Okay, so in the quarantine facility, it is a 24/7 operation. And the way the agreements were made is that the hotel staff is not, they're not there to provide the services. And what happened then is we provided our own workers there. And in order for them to be supervised and in order for us to respond to the services that are needed for those individuals who are quarantined, who are scared, who are wanting to go home, we decided that someone of authority should be there to monitor and to supervise and to meet the needs of these people. So it was authorized for two individuals to be able to stay overnight and to be able to provide the services to our individuals. Your third question, Nick?
Oh, all of a sudden.
So it was only two.
Yes.
Okay.
Because we're hearing that it was more. But okay, I will follow up later. Thanks, Governor.
Thank you, Nick.
So was that it?
That was
the
the
end
end of
of
your
it?
You want
question.
more? You want more?
Thank you, Nick.
All of a sudden?
Next is PDN, Stephen Tiaco.
Oh.
Yes, hi, Governor.
Hi, Steve.
I know earlier you said that there'd be more guidance in the coming days about business reopenings. Is
Yes.
anything that can be shared right now about, in general about what's going to happen? Because,
Yeah.
some of these businesses are uncertain and they want to prepare for this, and it's,
Sure. So we have a panel of recovery advisors, and we work very closely with them. And as we have been saying all along, there are criterias and measurements that we are looking at in order to make the decision to open up. So as you are aware, the strategy since April 25th was to go out and expand our testing capabilities. And so far, we have done that. And I am actually very excited that we maintained our low numbers.
Because they're testing
We even
wrong.
went to clusters, and as a result of that, we were actually getting really good results, Steve. Some days there was no positives, some days there was only one or two, so that's good. And we have always said that we are looking at at 14 days until we then decide to open some of the activities on our island. So what I'm looking at is by May 9th, I think 9th or 10th, we are going to start lifting some of these restrictions. And I'm thinking about lifting restrictions. Ricky and I were just talking about that today, that we would lift restrictions for retails, lift restrictions for real estate people, lift restrictions for shopping centers. They can go to the shopping centers, but they cannot congregate in the food court. They can take out food in the food court. I don't remember all the other ones, but what the bottom line is, the basic guide for that, for our people's behavior, is that we need to make sure that social distancing is adhered to, masks are used. These businesses that are going to be opening, they have already sent in their standard operations plan, which addresses occupancy into the retail, addresses making sure that they sanitize, making sure they're wearing a mask. So the industry themselves submits their own standard operations in terms of trying to adhere to social distancing and making sure that there's minimal contact, and so therefore decrease transmission and decrease exposure to contamination. And that would then go through the public health people. They would look at that, and then they would put it in their website as the public health guidelines for the particular business. So So in terms of timeframes, I am looking by May 9th. I think May 9th is the 14th day. Do you want to add anything?
Yeah, Steve, may I add, as it relates to, I know there's a lot of questions regarding when and where these industry representatives can submit these standard operating procedures that the governor mentioned, or adjusted operations guidance or guidelines. And public health, in working with public health and the recovery panel advisors, what we're doing is we're expecting to release a public health advisory very similar to 2020-05 that had all of the specific essential businesses, essential activities, essential essential other, I guess, construction services and things like that we'll be updating to include those specific businesses that will initially be authorized as being able to open. I think in terms of our recovery plan, there's obviously the how, and public health, in coordination with the recovery panel of advisors, will be issuing some very minimum pandemic workplace readiness guidelines that should be out, such that these guidelines that are submitted by industries will at least have some minimum guidelines that they're following in terms of social distancing, cleaning, preparing the workplace, training employees, communicating to employees and customers, and things like that. So that's expected to be released. In terms of submitting and where to submit these guidelines, just to reiterate what we mentioned in the last week Thursday, is that the Chamber of Commerce and the Women's Chamber of Commerce has been working very closely with the business community, with their members and other individuals and other businesses that may not be members, to be submitting these guidelines by industry. So the expectation is not submitting guidelines by business, but it's by industry. And once we release the advisory from public health, then we will know which industries will be authorized and therefore need to submit these guidelines. So.
Okay, and as a follow-up, it sounds like, so retail is going to be okay. What about services like hair salons or even just eating in a restaurant? Is that still going to be prohibited come May 9th, as far as you know?
Okay, so yeah, services like hair salons, nail salons are going to be allowed to open, but again with limited occupancy, and their guidelines are that they can't wait in the waiting area. They have to wait outside their car. They can only do it by reservations, by appointments. So again, that's to minimize the congregate issue. And that's the other industry that we're looking at. I also wanted to let you know that but we are looking at doing social gatherings and family gatherings and faith-based gathering of no more than 10 people.
Thank you, Steve. The next is Mariana's Business Journal. Wayne Chargaloff.
Could I just make a correction here? We're looking to lift these restrictions on May 11th.
Thank you, Governor. Wayne Chargaloff from Mariana's Business Journal.
Hello, everyone. Hello, Governor. Hello. According to the CARES Act budget that was released, it shows more than $313,000 will be devoted to testing. Would that be enough to purchase test kits and supplies to test the entire island, and with those funds?
Those funds are budgeted. Yes, it probably is not going to be enough for all the other for the whole island, and we are going to test as much as we can. But also, CDC provides some of the testings. FEMA will also provide some of the testing. So there are other sources of funds that will provide for testing. So the $383,000 is what we are going to be using from the CARES Act. But there are also other sources of funding that is being used to provide the test kits. And I know Public Health has its own grants also, and FEMA has their own capacity to provide the funds, and also CDC, World Health Organization, we're getting test kits from them, and also from HHS. Do you want to add anything to that, Mr.?
Thank you, Governor.
She's so nice.
Use deadlines for this fund source is December of this year. This is a buffer to be able to ensure that we have resources to be able to continue to test, as the governor has mentioned many times. This is going to be a marathon and not a sprint. So we just thought it would be incumbent to be able to have funding for COVID testing as part of the budget that she put together, utilizing the Coronavirus Relief Fund money.
Okay, and with the addition of those CARES Act funds, does that how does that affect the projected timeline for testing, and does that affect the model and timelines as far as testing, the pandemic conditions of readiness and that kind of thing? Like, does it speed up the timeline at all?
Not at all. I mean, the testing protocols are pretty standardized. So the swabbing, the testing, the result, and the verification, the notification, that process needs to be standardized and kept the way it is for accuracy, adherence to science, and CDC guidelines.
What it does do is it provides us the ability to get more test kits, and therefore we can test more people. But as far as the protocol, as far as the procedures and processes, it's the same throughout. It will also be able to give us more abilities to get people who are out there the test kits, so that like I said, so we can test more quicker maybe and faster.
Okay, thank you.
Thank you, Wayne. Next is PNC, Kevin Kerrigan.
Good afternoon, everyone. Governor, I wanted to ask you a question. The spending plan you submitted this morning, just how much of this $117.9 million has already been committed? And is this set in stone, or are you open to any change that might be suggested by the legislature?
So according to Ed from DOA, I think we've only spent a few $100,000 from the 117 million, and that's because we were also waiting for guidelines and advisories to be able to be guided on the ability or the allowable expenditures that we can use. And your second, what was your second concern there, Kevin?
This lady.
Kevin, are you there?
Yeah, I was muted, so I'm back now.
All right, so the other one was, is this budget
You have a
set in
suggestion for
stone,
change?
and is it subject to, can we make changes? Yes, we're very flexible about this. If there is something that is maybe a much more compelling need that we did not think about, and then it had evolved, we can certainly redo some of the allocations of these funds to provide for that need.
And I'd like to ask another question of Lester, if I could. Looking through some of the appropriations here, they don't all appear to be related to coronavirus. For example, it calls for $2.1 million for the Department of Corrections for things like paint, plumbing, AC supplies under the heading Maintaining State Prisons and County Jails. How did you shoehorn that in?
Kevin, every day my shoes go on very well. No horn necessary. But I'd like to just walk you guys through what my staff and the fiscal team helped to do to get to this point. we spent a lot of time getting agency input, guided by the Treasury guidance that we got dated April 22nd. The layout of the budget is consistent with the guidelines, so it's easier for anybody to follow sequentially items 1 through 6. Now, DOC provided a very detailed breakdown initially of about $90,000 of expenditures to be able to create a COVID-specific area, rehabilitate the area, so that there would be some further isolation within the walls of DOC. Late yesterday, they came back with a more detailed addition that totaled a little bit over $1 million, and I went through that list. And I looked at the specificity of it, the applicability of it, and I advised the governor that it not only was it extremely appropriate and timely, but well done. So I had no hesitation whatsoever in being able to take the amounts, both expended to date and necessary for future, social distancing, as well as some additional money for telecommunications, with the hope that we can minimize prisoner transfers for hearings, and we can conduct these types of activities electronically.
Thank you, Kevin. Next is K57, Patty Arroyo.
Just to be clear, Ricky, Dr. Hernandez, the easing of the restrictions, does that, on May 11th, does that actually bring us to PCOR 2? And does Public Health and the Department of Revenue and Taxation have the resources to ensure compliance?
Yes, so the movement to PCOR 2 is going to require an executive order to lift some of the existing restrictions that was extended when the governor extended the public health emergency. PCOR 2, again, is very flexible, right? Certain government agencies may or may not open depending on their ability and their preparedness to be open. So there may be phases of opening in PCOR 2 for certain government agencies, depending on their preparedness. As it relates to businesses, the expectation is that on that date, when PCOR 2 is declared, depending on the triggers that will have to obviously occur, and then that would inform the governor's decision on that. There would be an initial list of those types of businesses that will be added to those already essential activities that are authorized. And from there, that's not a closed list, right? Obviously, during PCOR 2, which is a minimum of 28 days until we could even think about PCOR 3, there could be existing businesses that are not part of the authorized list initially that could be part of it. And so I think in terms of which businesses and the questions that are related to what types of activities, that should be coming out in the next day or two.
So, Patty, is your question also related to is public health ready for it? I'm thinking you're asking about, can they do the testing? Can they do the monitoring? Can they make sure that the businesses are adhering to what they need to do to continue on with social distancing? So public health is prepared for increased testing, and they are also prepared for increased contact tracing. These are the two criteria that we will be really looking at to see how people's behaviors are in terms of adhering to the measures and the activities that we want them to do to continue containing and maintaining the COVID-19 decrease in positive cases. We're also going to be, of course, using other areas in public health to monitor, and also Department of Revenue and Tax will also be helping in terms of, in terms of going around and adhering to some of the measures that we will be putting in to provide for that protection. So we have discussed this with public health, and we are prepared to provide the necessary personnel.
Thank you, Governor. And so my second question is on this Executive Order 2020-12, which provides direct assistance through public health. Is this money actually fronting for the stimulus funds that we should be coming down in the next several weeks for this particular group of people that fall within 165% of the poverty level?
So Patty, no, it does not. It's not fronting for the stimulus checks that we will actually be getting maybe by the second week, by within the period of 2 weeks. But what this is doing is this is a local program that I have created to provide for our people who are out there struggling to make ends meet, who have made sacrifices to help us with the containment of the coronavirus 19, and this is to help them with their livelihood, in addition to the other federal programs that will be coming. So this is actually targeting 55,000 people. This is something that we have established through public health and under the General Assistance Program. And we heard, and we are very sensitive, and we empathize what people are feeling out there, how people are out there, and again, their struggles to make ends meet, their fears about when are they going to get their income, how are they going to pay their rent, how are they going to put food on the table. It's really a tragic kind of event to go through. And so as a result of this, to make it a little bit at ease, I created this program in Salapi Azudanitauto for our people to get over that. And then as soon as the stimulus checks come in, that would also help them. And then as soon as the pandemic unemployment benefit program continues, is established and is started. And additionally, I'm just also very glad to hear that the PPP program that we have out there has given a lot of financial aid to the businesses, which would then help continue on employing our people. So that's another means of income for our people. And I just have to say the PPP program, Patty, is very generous. This is a complete grant. If you use 75% of the loan for your payroll, and again, it's to incentivize our businesses, even if they are closed, to continue to hire and continue employing their employees so that they'll still get an income. And once that happens, then after the period of this program, the grant will be given to them. So for example, if a business borrowed 100,000, conceivably that 100,000 will be forgiven. They don't have to pay for it.
Right.
So there's a lot of really good, generous programs that the federal government has given out to us, the territories, and I'll tell you, they have not forgotten the territories. In all of my conferences with the president and the vice president and all the heads of the cabinet, they include the territories. And I think Ricky wants to add.
Yeah, just to add to the PPP numbers, there's about over 1,500 businesses that have been authorized, approved, and or have received their money, totaling 185 million. So the governor mentioned that 75% of that is, if they want it to be forgiven, has to be toward payroll costs. So that's 138 million that has to be put toward payroll costs, whereas the other part, the other 25% is for rent, utilities, and interest on debt obligations.
And that roughly equates to be about 17,000 employees. I think we sort of estimated.
Okay, thank you, Governor. I see that Janella has not yet muted me after my second question, but I'm going to be an honest person and allow my time to be given up since I've already asked to, out of all fairness to the other media.
Thank you. Appreciate that, Patty. Next is KUAM, Nestor Lecanto.
Thank you. Good afternoon, Governor, Lester, and Ricky.
Good afternoon, Nestor.
Yeah, I wanted to get back to the program in Salapi. So this is will be through the Department of Public Health, correct? And so people do not have to do anything to get their money?
So we do have data. We're using the SNAP program data, and I think we're using MIP and Medicaid program data. And so right off the bat, we already have that information, and we're looking to start sending out the checks on Friday. We're looking, like I said, about 55,000 people. But we're also telling people to apply, and they can go online and download or print out the application, fill out the application, and they can drop it off at Public Health. There's a drop box. So we are asking people to apply if they're not on the SNAP program and if they're not on Medicaid or MIP. And if they qualify with that 165% poverty level,
What's that salary level? What's that number?
That's about, like, for one household, it's about 1,760 a month, and then it goes up to almost 3,000 a month, right, for a household of 15.
Yeah, so the federal poverty level is published by the Department of Public Health and Social Services, and it's dependent on the household size. So as the governor said, a household size of one is a little over $1,700 a month. That's 165% of the federal poverty level. Up to, and there's households of up to 14 people, and there's an income threshold for that equates to 165% of the federal poverty level. So it depends on the number in the household that will drive the dollar amount that you may want to know about. But that's already listed on the Department of Public Health and Social Services under all of their public assistance programs.
So Ricky, for an average family of 5, is it a combined income level? What's the number?
For a family or a household of 5 is $4,149 a month for a household of 5. And a household could be children, it could be multiple adults. It's just a household of 5. And the application process is very similar, or will be similar, at least currently, as anyone that would be interested in think they're eligible for SNAP. And the other eligibility requirements, I think, is that you have to be 18 years old or older, and you have to be a Guam resident at least 6 months. Yeah, so.
Okay, and how about the people who've already received the 1,200 advanced stimulus? They're also eligible for this, correct?
Yes, it's a different program, so it is conceivable that you have gotten the 1,200, and you will also be able to get this program.
And how much have you set aside, Governor, for this?
I think we set aside $20 million.
Okay, and that was contained in your spending plan, right?
Yes.
And there's another $20 million for businesses?
Yes.
And how's that going to work?
We're doing that through GIDA, and so we've given them $20 million to help out with the small businesses, and Ricky can also give you some information about it.
Yeah, the CARES Act, the coronavirus relief funds, that's the $117.9 million. there's guidelines in there that allows for grants, direct grants to, as it relates to covering costs of business interruption for businesses. And so currently we're putting together some programs to assist different types of businesses, mainly by size. So those guidelines, obviously, the governor was generous enough to be able to put, at least, and Lester and the team was able to put some money aside, $20 million, not only for individual assistance, which the governor is announcing today, but also $20 million for grants to businesses. So $40 million of the 117.8 was dedicated to these two things. And so those announcements for those business grants related to business interruption will be announced at a later time.
Okay, and I have one more question. I have one more question for the governor before I pass it on. And I'm going to editorialize a little bit here. Do you feel you waited too long and maybe underestimated the level of financial